One of the world's first and most successful large civilizations was that of the ancient Egyptians. The Egyptians lived in a civilization that was fundamentally well-structured. They had a highly developed agricultural economy, a highly organized administration, and proper law enforcement, all of which contributed to a sense of stability in their day-to-day existence, which in turn fostered the growth of research and recording. The ancient Egyptians, via a process of experimentation and learning from their mistakes, were able to discover medical remedies that were decades ahead of their time, and of which many are still used today. Ancient Egyptian medical procedures were able to cure a broad variety of surface diseases, putting them ahead of the curve among other civilizations of their time period. This was made possible by the usage of some of the world's oldest surgical tools, which were used in these operations. This list investigates the field of surgery and medicine in ancient Egypt, a time period for which numerous records exist as a result of the culture's long-standing tradition of diligent record-keeping. Ancient Egyptians may have started the practice of male circumcision. Some people believe that the ancient Egyptians were the ones who first performed male circumcision. However, this is just a theory. It is known that the Egyptians taught other cultures how to perform circumcision. As the ancient Greek historian Herodotus wrote in the middle of the 5th century BCE, they are the only people in the world, they at least, and such as have learnt the practice from them, who use circumcision, and such as have learned the practice from them. The Egyptians performed circumcision as a means of maintaining personal hygiene because they believe that it is better to be cleanly than comely. Some people believe that the ancient Egyptians performed circumcisions on males during their pre-adolescent years rather than when they were infants, which has led them to the conclusion that the practice was a ceremony to mark the passage from boyhood to adulthood. The fact that not all mummified monarchs appear to have been circumcised suggests that the procedure did not serve to signify a person's social class or status in ancient Egypt. An essential point to emphasize is that there was no such thing as anesthetic back then. Dental surgery was painful and ineffective. The typical ancient Egyptian's diet was not precisely one that encouraged the development of a beautiful set of teeth. Because the implements that were used to crush food frequently left behind traces of sand and stone, both of which are inherently abrasive, this frequently resulted in the loss of teeth at an early age. According to the Ebers Papyrus, an ancient Egyptian remedy for a toothache involved rubbing a powdered mixture of onion, cumin, and incense on the tooth in question. Other ancient Egyptian treatments for dental conditions were equally odd and excruciating. Although there are examples of ancient Egyptians drilling into jawbones to drain abscesses of fluid and filling cavities with a mixture of glue and a greenish mineral that included copper, and also drilling into jawbones to drain abscesses of fluid. It is interesting to note that the procedure of tooth extraction, which is frequently life-saving in cases of infection, was practically never utilized. Surgeries may have been performed by the first female doctors in recorded history. The ancient Egyptians were much ahead of their time when it came to technology, and they were also known for their progressive achievements in the area of civil rights. It should come as little surprise that the earliest recorded case of a female doctor occurred in ancient Egypt, given that Egypt was the first at many milestones on the path to the development of medicine. Merit-ptah, who lived around 2700 BCE, is credited with being the first woman physician in recorded history. She most likely held the title of chief physician, which meant that she had the authority to instruct, that she had supervision over male peers, and that she personally attended to the king or queen at that time. Egypt probably had the first prosthetics, evidenced by wooden toe. Ancient Egypt had a culture that was known for being innovative, and it is extremely possible that the world's first prosthetics were utilized in that culture. A female mummy that was unearthed near Luxor, Egypt, and whose death was dated to between 950 and 710 BCE, was found to have a wooden and leather prosthetic toe on her right foot. The concept of a cosmetic replacement for a toe that had been severed is an astonishing innovation, but experts at the University of Manchester claim that it may actually have helped the woman walk. The prosthetic toe exhibited considerable symptoms of wear, which prompted university researchers to carry out a study in which they evaluated the participants' walking patterns both with and without the assistance of the reproduced finger. It was discovered that walking around in sandals, which were the most common type of footwear in ancient Egypt, would have been quite challenging for someone missing their big toe. As a result, prostheses, such as the one that was discovered on the corpse from Luxor, were used to help those who were affected by this condition. They fashioned surgical instruments that are still used today. Ancient Egypt was a civilization that was known for significant invention, including the development of useful surgical instruments that assisted in medical treatment. The ancient Egyptians had versions of pincers, forceps, spoons, saws, hooks, and knives, all of which may be seen in medical facilities today. These instruments were primarily manufactured from copper, which was a newly discovered metal at the time. They also made great bandages and had the insight to infuse them with willow leaves to alleviate inflammation, a method that was extremely advanced for its time. This allowed them to treat inflammation in a manner that was both effective and efficient. They were knowledgeable on the functions of major organs. Ancient Egyptian medical practitioners actually had a relatively comprehensive knowledge of the internal organs and how their functions were carried out, despite the fact that invasive surgery was an incredibly uncommon practice in that time period. The Ebers Papyrus, which is one of the oldest writings that have been preserved relating to medical procedures, contains illustrations of the ways in which people at the time thought essential organs worked. There are some hypotheses that are only somewhat off, but there are others that are remarkably accurate in their predictions. The following are some excerpts from the document, rendered in current language. The cardiovascular system. From the heart, there are vessels to all four limbs, to every part of the body. The mechanism of respiration. When we breathe in through our noses, the air enters our hearts and lungs, and then the entire belly. The liver is supplied with liquid and air via 4 different vessels. They trigger a wide variety of disorders by flooding the liver with an excessive amount of blood. And last but not least, the anus. The liquid and air that exit the anus come from 4 vessels. When the vessels in the arms and legs are filled to capacity with waste, the anus is also exposed to the waste that is being carried by those vessels. Post-mortem dissection was common, but little was learned from it. The ancient Egyptians are famous for their highly developed method of mummification, which has led to a better understanding of how they operated as a community and how they considered the importance of maintaining public health. The process of mummification is an extremely invasive one that involves thorough dissection to remove moisture from the body. This dissection can include the removal of brain tissue through the nostril using a gruesome hook implement. As a result, the priests who performed the sacred act were able to get a very close look at the internal organs of human beings. Mummification was considered a sacred act in ancient Egypt. It is interesting to note that the knowledge gained by mummification was never put to any kind of medicinal application. The fact that priests and physicians of the time did not move in the same social circles provides one plausible explanation for this phenomenon. As a result, communication between the two groups simply did not exist. It has been seen as a peculiar oversight for a civilization that conducted such meticulous recording throughout their history. Procedures were performed as early as 3300 BCE. Ancient Egyptians were known for being overachievers, as evidenced by the fact that they were already practicing medicine in 3300 BCE. They began treating war wounds, snake bites, scorpion stings, and other topical ailments, putting them ahead of other civilizations that existed at the same age as them. This was largely accomplished by trial and error. Even though the average life expectancy in ancient Egypt was approximately 34 years at the time, you were considerably better off living in a society that had the ability to cure burns and set broken bones than you were in a society that considered such injuries to be a death sentence. They used both science and the supernatural to treat injuries. Even though the ancient Egyptians had access to a wide variety of effective medicines, their primary method of treatment was still heavily dependent on the use of magic. Because they believed that all illnesses had supernatural origins, they also believed that healing relied on the supernatural, which is why traditional medical therapy typically included a spell to aid in the patient's recovery. A cure for whooping cough is an illustration of this type of product. After administering a ground, roasted mouse mixed into milk as part of the medical therapy, the patient would then get the mystical assistance of a lullaby that drove away evil spirits. It is widely held that the observed success of these practices can be attributed, at least in part, to the potency of the placebo effect. They were adept at stitches and setting broken bones. Invasive surgery was not practiced in ancient Egypt for the simple reason that it was not possible. Due to a shortage of anesthetic and antiseptic, it was practically impossible to do so because doing so would have resulted in unbearable pain and an extremely high risk of passing away from infection. On the other hand, the ancient Egyptians were very skilled in the use of topical treatments. They possessed a functional understanding of how to fix broken bones and repair dislocations, and they utilized wooden splints and linens in their treatment procedures. We hope you like this video, subscribe to the channel if you're a history addict, and please let us know about what civilization or time period we should talk about. Also, watch another video here.